Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video, I'm going to be educating you about a topic that is incredibly common after lumpectomy and radiation, that is breast pain. So if you enjoy this content and you would like to see more, then please give it a big thumbs up. Subscribe to my channel, which is completely free, and leave a comment in the section below because I would love to hear from you and find out what topics around breast cancer you would like more information on. So without further ado, let's get into this video, breast pain after breast cancer treatment. So what we're specifically talking about here in regards to pain is pain following a lumpectomy and radiation. Now, often this pain doesn't start for some weeks or even months after treatment has completed. So it's not necessarily an immediate pain that people are experiencing, it's a latent effect. And the latent effect is a combination of the scarring that occurs from radiation and surgery. So firstly, let's just talk about symptoms of this pain. Before we do though, I'll make a quick mention of the fact that this video is obviously specific to lumpectomy. I'll do a separate video where I talk about chest wall pain if you've had a mastectomy. So women often present with breast pain in the form of shooting pains into the breast, or what they describe as lightning bolt pains. It can actually be so severe that it can leave you, clutching at your chest in pain when it happens. They can often happen randomly as well. It doesn't necessarily need to be a mechanical movement that's causing that pain. They can suddenly come out of nowhere, usually at the most inappropriate times, and it can leave you, gasping for breath for a couple of seconds, but then the pains tend to go away. So that's one classic symptom of the breast pain that we're talking about here. The breast can also become hard, firm, or mildly swollen. It can be very swollen in some cases. You can get extreme cases where, lymphedema of the breast is actually diagnosed as a side effect of this condition. So keep an eye out for the differences in the size between your breasts. If you have your normal breast remaining on the opposite side, then consider comparing the size of the breast to the other side, because if there is swelling involved, then we need to take this into account when we're considering treatment techniques. There's also another symptom called poda orange, which is a side effect of the tension that's caused in the skin from radiation scarring. So this actually makes the skin look like the surface of an orange peel. And the reason this happens is because the amount of tension in the tissue actually causes the hair follicles to become inverted. So if you notice an orange peel type covering over the breast on the skin, that's called poda orange, and it's a very common side effect of radiation fibrosis scarring. You might also notice indentations from the bra that you're wearing. So if you take your bra off at the end of the day or before bed and you notice that on the side that you've had radiation performed, that there's markings from the bra or indentations on your skin that aren't on the other side, or are new indentations that aren't usually there, then that's another reason to consider that you might have radiation fibrosis scarring. The other take-home message is that the tissue on the breast will start to look firmer, it will feel firmer, it will feel thicker, it may feel mildly swollen. So these are all classic signs and symptoms of what we coin radiation fibrosis scarring. Let's move on to treatment. So what do we actually do about this problem? So the great take-home message from this video is that this condition is often very treatable. There are plenty of patients who I've seen for a stint of sessions of physiotherapy for this problem, and we have managed to get them a lot better, if not self-managing or getting the condition completely resolved. There are circumstances by which the radiation fibrosis scarring can be particularly severe. It can cause the tissue to become extremely thickened, tight, and can leave the breast extremely swollen as well. So there are cases where we haven't been able to resolve this condition, but I would say they're more on the extreme range. So the three main treatment techniques that we use to resolve radiation fibrosis scarring is breast massage, a product called Mobiderm, which I will show you in a moment, and a well-prescribed bra that will help reduce swelling and will enhance the effect of the Mobiderm. So let's firstly talk about breast massage. Breast massage is one of the most common treatment techniques that I use for radiation fibrosis scarring following a lumpectomy and radiation. Now, the way I perform breast massage is basically with firm pressure. I'm not terribly concerned about the direction in which I'm performing this massage. I'm not necessarily trying to create, flushing of swelling, although that may be part and parcel of what I'm doing. But the main priority for me at this point in time is to actually break up that tissue. The irony is that once the tissue is softer, you'll get a better lymphatic flow through the breast anyway. So if swelling is a side effect of breast radiation scarring, then the best thing you can do is actually just firstly work on getting the tissue mobile. Now, if we actually want to consider that swelling is a side effect of radiation fibrosis scarring, as well as thickened tissue, and we want to direct the flow of the massage to create a flushing of, excess fluid, then generally the best direction to push the fluid is going to be either into the middle of the body or generally up towards the collarbone. I'm just going to put a link in the section below, guys, as to a recent research article from Macquarie University that describes lymphatic drainage from the breast. So I'll include that link down the bottom so that you can look into that research for lymphatic drainage of the breast if you'd like to do a little bit more reading on that topic. Now, when I pitch duration of breast massage, I usually try to work in with the logistics and the practicality for each individual person. So if you can spend 3 to 5 minutes once a day massaging your breast, then so be it. It tends to be based on, how severe the condition is. So if you've got a really large, swollen, hard, uncomfortable breast, then you might spend closer to 10 minutes a day doing your massage. But if you've got a smaller breast and the symptoms are not as severe, then sometimes I will tend to focus more on the frequency of the massage. So, getting people to do it every day rather than trying to do 3 sessions a day that are 20 minutes long, which is just not necessarily practical for each person. The other reason I like people to do massage, of 3 to 5 minutes at a time is because, and once a day at that, is because I've found that if you massage your breast too many times during the day, it can actually make the breast tissue sorer than it needs to be. So I would rather patients perform their massage once every day, do a good job once a day, but do that every day, and then you'll tend to get better results rather than pummeling the breast 3 or 4 times a day really firmly and then creating a side problem, which is a sorer breast just because of the treatment. Now, in the background behind me, you'll see there's 3 different moisturizers. Because we're performing firm massage on the breast, we do actually want to use a moisturizing cream. So behind me, I've got the 3 creams that are my go-to creams. Mugu is on the left, the QV is in the middle, and then Sorboline's the last one on the side. So all of these creams are readily available in major supermarkets or major chemist chains. And they're all water-based and they're low pH, they're low irritability on skin. So the bonus of using, these moisturizer creams, of course, is then you're also hydrating the skin. So when radiation is performed, it often, can dry out skin. So keeping the skin moisturized is a really good side effect of using one of these creams as you're performing your moisturizer. So you're not only breaking up scar tissue, you're also hydrating the skin, which is a really good thing. I should also mention with breast massage that this is something that I perform on my patients on a very regular basis. So it is actually great to go along to a physiotherapist who specializes in breast cancer and get them to perform the massage on you, because that'll give you a much better gauge as to the direction of the massage, how long they do the massage for, what pressures they use, what creams they use that they found helpful. When someone can perform this massage on you and they have a really good level of expertise and they specialize in this area, then you'll get a much better improvement with this condition of breast pain after lumpectomy and radiation. They should then also be able to teach you how to perform this massage. In a separate video, I'll actually have a patient with me and I will perform this massage, and we'll actually record me doing the massage so that you can actually get a much better gauge of direction of massage and pressures and that sort of thing, because I can't tell you guys how common this problem is and how undertreated and underdiagnosed this problem is. So yeah, get yourself along to a really good physiotherapist or occupational therapist who specializes in breast cancer, who can help you specifically with this problem. So let's talk about Mobiderm. Mobiderm is a fantastic product that I use every single week for this issue of breast pain after lumpectomy and radiation. I'll just show you what it looks like. So this is Mobiderm. It is literally pieces of foam stuck between two pieces of hypoallergenic tape. So it's an incredibly basic product, but my goodness, it works so well at breaking up radiation fibrosis scarring. So what we use this product, or the way we use this product, is to place it inside the bra of the patient so that it can be held in place directly against the skin of the breast. So there's no problem with wearing this product directly against your skin because this tape is hypoallergenic. And as you can see, the contours of the foam, as it rests against your skin and you're moving around during the day, this is basically creating a massaging effect against the breast, and it will help break up the scar tissue. So I'll put a link to Mobiderm in the section below so you can go and check it out as a potential product to purchase if you've got this issue. One word of warning about wearing Mobiderm during the day: if you wear this against your chest wall for even half an hour, when you take it off, it will leave a waffle pattern against your breast. If this happens, it's no reason to be alarmed. It's actually, suggesting that it's actually doing its job. So just be aware that it can leave a dimpled waffle pattern against the breast. So very normal, but just something to be aware of. Most of the time, I will tell women to put Mobiderm in at the start of the day and see if you can leave it in for the majority of the day. I have had patients sleep with this at night because it's been so effective for them. There's no problem in sleeping with this on. It's totally safe, but it's not necessary that you have to wear it overnight. I think it's got its greatest benefits by which, when you're moving around during the day, it's acting as a massager on the breast tissue. The only time I've told patients to stop wearing their Mobiderm is if the tissue's a little bit too sensitive to tolerate this product against their skin. So I've only had a handful of patients where they've actually had to cease wearing the Mobiderm for a time until the breast tissue actually becomes a little bit softer and more comfortable to tolerate the product. So if you're getting pain while you're wearing the Mobiderm, either consider wearing it for a much shorter period of time, like an hour or 2 hours, and then taking it out for the rest of the day, or even just cease wearing it completely until you've had a little bit more time massaging the breast, getting that tissue soft, working with your therapist, and you'll probably find that a little bit down the track you can go back to wearing the Mobiderm with good effect. Now let's just talk about bras, because there's a lot of women who have breast pain after lumpectomy and radiation scarring, and they will tend to compensate with that breast pain by just wearing an old bra that happens to feel the most potentially comfortable that they can wear, rather than actually going to a lingerie and prosthetics specialist and getting a really good bra fitted. So there are companies out there like on the Sunshine Coast in Queensland. We have a fantastic lady by the name of Tracy Grills who owns Tracy G Lingerie and Prosthetics. She has a specialty store in Brisbane and on the Sunshine Coast, and this is a store that you can go to that specialises in bras and swimwear as well, following breast cancer treatment. So whether you had a mastectomy, whether you've had a lumpectomy, you can get down to her store and she can, her and her staff can fit you for a really good bra when you've got these sorts of issues going on. So a well-fitted bra is really important, and one that's actually going to support the breast. We definitely recommend avoiding bras with underwires in them because the underwire can block lymphatic flow. Now, if you think about it, if you've got a firm swollen breast, as you stand up during the day, gravity is going to have a major influence on that tissue. So any excess swelling in the breast is actually going to drop down to the base of the breast. And what I often find is that when I treat women for the first few times with this breast pain after lumpectomy and radiation, the thickest part of the tissue is actually at the base of the breast, because gravity has taken all that fluid sitting in the breast to the base, and it's sitting there and it's thickening up as the day goes on. So avoiding wearing an underwire can help prevent even more thickening and hardening at the base of the breast. So the take-home message with bras is don't compensate by wearing an old, bra that you've pulled out of the back of your wardrobe cupboard. Go and get yourself fitted with a really good supportive bra, and try to get to a lingerie store that actually specialises in looking after patients with breast cancer. So they're the three main treatment techniques that we use for breast pain after lumpectomy and radiation. Breast massage, either done by a physiotherapist or other lymphedema therapist. Mobiderm as a product that you can wear during the day to help break up the adhesions of the breast and help increase lymphatic flow. And then getting a really well-fitted bra to help support the breast during the day as you're moving around. And obviously the bra also helps keep the Mobiderm in place. So the take-home message from this video, ladies and gents, is that breast pain after lumpectomy and radiation should not be considered a new normal. I strongly believe that this is a condition that is quite readily treatable. Sure, it might not be completely resolved in every single patient, but for the majority of patients, we can create a situation by which, with good treatment and the right products, we can really make this condition either resolve or get it to a point where it's incredibly manageable. You can be looking at after yourself. What I would love to do is get the word out about this problem. If you are going through breast cancer or you are following breast cancer treatment, please speak to your GP, your medical specialist, and particularly your radiation oncologist and radiation therapist about this topic. Because I think what happens is that once you leave that last radiation session particularly, there's not a lot of contact with the staff at the radiation centres, and my gut feel is that they're not really appreciating that this is a condition that is super, super common, and they often don't know what to do about it. So people will present back to their medical teams, 6-12 months down the track saying, geez, my breast is really hard, firm, swollen now. And the common response is, well, you're just going to have to learn to live with this. I don't believe that's true. As I've described in this video, I think there's lots of treatment techniques we can use to manage this condition. So please spread the word. And you are very welcome to suggest that they watch this video so that they can refer patients on early to a physiotherapist or lymphedema therapist who specialises in breast cancer treatment. I've actually changed my tune a little bit of late, where I am now taking a step further with my patients who are working towards starting radiation, and I'm educating them on the fact that as soon as any radiation burns are completely healed, that we really should be starting breast massage as a preventative towards radiation fibrosis scarring. Radiation fibrosis scarring is the condition that is causing the breast pain, the breast swelling, the firmness, the thickness of the tissue. So once your burns are healed, you really should be just doing once daily massage on the breast with the idea that you're breaking up the tissue. So the moisturizing that we were doing during radiation just to keep the skin hydrated to reduce the risk of the burns or the severity of the burns, we're changing tact a little bit to focus on the flexibility of the breast tissue rather than just keeping it hydrated. So as soon as those burns are all healed up, or as soon as your skin is not tender to touch anymore, then make sure just once a day that you're massaging your breast and keeping that tissue as soft as possible. I also believe that if you used Mobiderm, this product, as a preventative, that we would see a lot less radiation fibrosis scarring after radiation's finished. I also just wanted to mention that I believe we can really empower patients so much more if we give them education about what's potentially coming down the track. You're already scared as a breast cancer patient. It's very scary going through breast cancer. So if we actually withhold information as health professionals to suggest that, latent effects from radiation are not, even on the agenda, then we're probably not doing our patients much favor by not telling them what's, potentially down the track. So I love to educate my patients that are going towards radiation now about the possibility that this treatment can influence their breast tissue and what signs and symptoms they can look out for with radiation fibrosis scarring. So the more prevention education we can give our patients, the more control they're going to feel, the more empowered they're going to feel. So to any health professionals out there that work with breast cancer patients, please inform them about the latent effects of radiation on breast tissue. Thank you so much for watching this video. I really hope you enjoyed it and got some really valuable information out of it. I release a new video every week around the topic of breast cancer, so please subscribe to my channel and then click the little bell on the right hand side of that subscribe button. That will allow you to get notified when a new video is coming out. I hope you're having a great week wherever you are. Thank you so much for listening. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.